I had a severe amount of pain, especially in my right shoulder, and it was prominent during sleep time. When I sleep on my left side or right side, I was always switching sides. Constant pain, took a lot of pain pills, and finally got to the point where I needed to do something, so I came to see Dr. Aldrich to see what was wrong and see what we might do.
If someone's having pain in their shoulder, pretty likely it's the rotator cuff. The rotator cuff is an area of the body that does not have great blood supply, so it tends to break down over time and not heal itself very well. So most of us, as we get older, do start to have some breakdown in their rotator cuff. This presents in a variety of ways, but usually is a kind of a chronically developing pain. There's usually not one incident. Occasionally there is, but more of the time it's more of a chronic repetitive use type of injury. And they start to notice that they have pain, especially with reaching away from the body. A lot of times they'll have pain at night. Trying to lay on that shoulder will become painful. And then as the disease gets worse, they will have pain, not just pain, but weakness.
So we had x-rays, we had MRIs, he got those back, and then called me in. He had the data and said that I had a particular problem, and then he gave me alternatives of how he would approach in order to solve those problems.
We found that he had a partial tear of his rotator cuff, but did not have a complete tear. However, he had a lot of the things that go along with this. Bone spurs, damage to the end of his collarbone, and also involvement of the biceps tendon. We were able to deal with all those issues arthroscopically. We can remove the bone spurs, we can fix the biceps tendon, we can clean out any inflammation, and if there's any tears, we can fix those at the same time as well. In his case, he did not have any cuff tears that needed to be repaired. He just needed everything kind of cleaned up and fixed. The recovery is very quick. He's basically starting movement of it the next morning.
Well, my overall experience with Dr. Aldrich, I'd just say was outstanding. Great guy, great physician. Everything went according to what he told me was going to happen, and I feel wonderful, and I'm thankful for it.